1 in 3 people experience poor sleep from what's called body clock desynchronization, meaning that they're not sleeping at the optimal time where their bodies are most inclined to sleep, and therefore their sleep suffers. Hi everyone, I'm Biquan, co-founder and CEO of Lumos. One day, I received a call from the human performance expert in the US Special Operations Command. He told me that their operators have trouble sleeping when they're deployed and asked if we could help. It's not just the military. In fact, 1 in 3 people experience poor sleep from what's called body clock desynchronization, meaning that they're not sleeping at the optimal time where their bodies are most inclined to sleep, and therefore their sleep suffers. The most common examples include jet lag and night shift. The more common but less known examples include having trouble falling asleep, having trouble waking up, or waking up feeling groggy. And these are the sleep problems that Lumos is set to solve. Before we get into the product, let's look at the science first. Inside our body, there's this biological clock that determines when we sleep and wake up. Scientifically, it's called the circadian rhythm. It is well established that healthy circadian rhythm are the foundation for a good night's sleep. When your circadian rhythm is desynchronized, it causes poor sleep, low energy, sour mood or depression, as well as increased risk for disease such as cancer, diabetes, and cardiovascular disease. And Lumos is designed to solve circadian rhythm disruption so that people can get better sleep and stronger performance. The technology behind Lumos came from Stanford research, and our product development was supported by NASA, the Special Operations Command, and multiple clinical studies were conducted at University of Pittsburgh. The system consists of a mobile app where the users will input their sleep needs, and then we have our proprietary algorithm to generate their sleep program for them. These personalized sleep programs will then send to a soft, breathable sleep mask that the users wear during sleep. When the users are sleeping, the mask will emit very short, low-intensity millisecond light flashes that penetrates through the user's eyelid. These light flashes, based on decades of research at Stanford, was able to regulate human circadian rhythm. From a high level, if your current circadian rhythm and your target circadian rhythms are misaligned, our goal is to bring these two together so you will have better sleep, better energy, better mood, and better health. In a double-blind, placebo-controlled clinical study funded by the Department of Defense on night shift workers who have notoriously bad sleep because of circadian clock desynchronization, we were able to show that with Lumos, we're able to shorten the time taken to fall asleep. We're able to reduce their wake duration when they're sleeping. And then when they're doing night shift, we're able to increase their alertness and reduce their reaction time and mistakes. We've attracted the attention of various high-performance organizations, including the US military, the US Department of State, the NBA, the WNBA, and the US Olympic committees. Our users including high-profile athletes, including world champion athletes. But we're not building a hardware product for sleep. What we're building is a system that takes advantage of all available tools to help people get the optimal performance. So we have our circadian rhythm algorithm with sleep coaching, with nutrition and exercise science. With all those toolkits, we're connecting them together to coach the user when and how to use these tools so that they can achieve optimal performance and well-being. Because of these various tools, we also have various revenue streams. So far, we've raised $2.58 million SBIR in phase 1 and phase 2. We have patents granted. We've sold 1,200 units, and 89% of users who've used the mask rated it as effective. And we have positive data from human subject studies. In the next 12 to 18 months, we'll focus on commercialization and optimization of the supply chain. We're raising $1.2 million. And if you're interested, I would love to talk more. Thank you.
So B, clearly a lot of traction, clearly amazing IP from places like NASA, Stanford, et cetera. But sleep's a crowded market. What is your competitive differentiator compared to the devices that are out there? Like we've heard about Aura and Whoop and other types of products. How do you really differentiate?
Yeah, so we see the competitors have three categories. The first category is sleep products that track sleep but don't actively improve sleep. So that includes the Whoop and Aura that you mentioned. They track sleep. They tell you that you sleep well or you don't sleep well. But then after a few months, you run out of solutions. So compared to them, we provide an active solution to help users with the previous mentioned conditions. We can help them actively improve sleep. Then the second categories are the stimulants or sleep aids that most of our target customers currently use, including sleeping pills, melatonin, and coffee, and alcohol. So all these like substance. So the problem with them is they're effective short-term in inducing sleepiness or wakefulness. But in the long term, the users might develop higher tolerance, or maybe they have like negative health consequence side effects. So compared to them, our solution is non-invasive, non-pharmacological, therefore it's very safe. Then the third categories are products that uses light therapy to adjust to regulate human circadian rhythm. For example, there are like light emitting goggles, or there are light panels that you sit in front of for hours. There is also apps that tells you when to get to light exposure and when to avoid light exposure. So compared to them, we're more effective because we deliver the short light pulses that has been shown to be more effective than continuous light. And then because compared to those apps that only provide suggested time without a way for you to actually receive the light, and you're totally on your own to get light exposure, for example, at 2 in the morning, you're not going to get up at 2 in the morning to get light exposure. So with our technology, the users can achieve circadian rhythm regulation with the minimum user behavior change.
On your business model slide, what's really the user experience and how do the different revenue streams work?
So we're talking about not just having a single product, we're connecting different tools that the users can use to promote optimal human performance and well-being. So that includes circadian rhythm, sleep coaching, and then nutrition and exercise coaching. So all of these algorithms are in the app. So as a user, you can buy the mask and have access to the app that gives you all sorts of coaching. Or if you don't want to invest $200 or $300 upfront, you can get the app itself, which will also generate this personalized sleep programs and then the suggestion. But it's on you to get the light exposure, and it's on you to get all these other tools that we tell you when and how to use. And in the future, if you want to get a full benefit, you can opt in to get the sleep mask and get the app for free. Inside the app, when we have all this coaching, we will have affiliate program that links to different products that we validated, they're scientifically backed, they're effective, and they have the industry standard. So you can go ahead and get those tools if you want, and then that would be our affiliate program.
Got it. So B, it sounds like, from a patient standpoint or a consumer standpoint, just a lot more support. But one of the things that we've seen is a differentiator that you spoke about that really caught my attention was NASA, Stanford, and this intellectual property that you have. Can you tell us a little bit more about that IP?
Yeah, so we have granted US patent and we have PCT filed, but the most important differentiator in terms of IP is our trade secret, which is our algorithm that lives on the cloud that is not reviewed to the public.